Hello everyone. So here we are gonna tackle about the basic pharmacology of antiarrhythmic agents. So here are the major pharmacologic mechanisms of antiarrhythmic agents. First is the sodium channel blockade. Second is the blockade of sympathetic autonomic effects on the heart. Third is the prolongation of the effective refractory period. And fourth is the calcium channel blockade. Antiarrhythmic agents are the drugs that are used to suppress abnormal rhythms of the heart. They act in two actions. First is to interfere with the dynamics of the cardiac action potentials by blocking a certain ion channel. That is indicated in the first and second picture. In the first picture, you can see the abnormal rhythm of the heart without the drug, and in the second picture, the normalized rhythm of the heart with the drug. And second action is the blockade of the sympathetic effects of the autonomic system of the heart to slow down the rate. It is indicated in the third picture. So there are 5 classes of antiarrhythmic drugs. In the class 1, 2, 3, 4, and 5. But there are only 4 classes that have distinct mechanism of actions. And we are gonna discuss about that. So the first class is the sodium channel blockers. It is indicated in the first picture. The sodium channel blockers. So sodium channel blockers acts. You can see the yellow line, an abnormal action potential, while the blue line represents the normal action potential or yung action potential na naging normal dahil nag-administer na ng drug. Since madami ang sodium, mabilis ang pagde-depolarize ng cell. So, ang goal ng drug is to block the sodium potential, thereby mananormalize yung depolarization. Diba? Mas mahaba yung yellow line. Dahil sa maraming influx ng sodium. But since na-slow down ng sodium dahil sa sodium channel blocker, makikita nyo sa blue line, which represents the normal action potential na medyo umikli na naging curve na, which indicate na naging slow na or kumonti na yung influx ng sodium. Class 1 have a subclass, which are class 1A, 1B, and 1C, which represent, nakikita niyo sa second picture. The 1A represent the blue line, 1B, the pink line, and 1C, the red line. Each subclass defines the strength of sodium channel blockers, sodium channel blockage, and their effect on the duration of action and the effective refractory period. So, ano nga ba yung kahalagahan ng effective refractory period? Or yung kanyang essence or gamit niya. The longer the effective refractory period, it generally reduces the cardiac excitability. So kapag mas mahaba yung effective refractory period, mas slow yung heart rate. So class 1A shortens TRP, class 1B prolongs TRP, while class 1C has no effect on ERP. Prolonged repolarization. Yung repolarization niya is yung pababa na line. Pababa. Prolonged repolarization may increase the risk of torsades de pointes, a type of cardiac of tachycardium caused by after depolarization. So, imbis na bumaba na siya, biglang nag-increase yung after depolarization. That is what you call torsodipointes. Ito po yung nagre-represent sa effective refractory index. Yung line, yung sakop ng yellow rectangle na yan, yan yung buong effective refractory index. While yung torsodipointes na yan, imbis na pababa na siya, biglang nang increase yung after depolarization. So, nagkaroon ng sudden increase of after depolarization, nagkaroon ng torsodipointes. Mamaya, na-explain ko sa inyo kung ano yung drug na cause ng torsodipointes or adverse effect. Class 2 beta blockers. So, sympathetic nerve release catecholamines, which acts to increase SA node firing rate and cardiac conductibility, especially at the AV node. So, nag-act siya sa AV node. These activities may precipitate arrhythmias. So, ano bang ginagawa ng beta blockers? So, beta blockers suppress sympathetic effects, thereby decreasing heart rate and slowing down the conduction through the AV node. Po yung ginagawa ng beta blockers na sinusuppress niya sympathetic effect, thereby decreasing the heart rate through the AV node and slowing the conduction to the AV node. So next is the class 3 potassium channels. These agents block the potassium channel responsible for the repolarizing phase. So dito na po papasok yung torsodipointes na sinasabi ko kanina. Yung pababa na line is the repolarizing phase. The result is slowed repolarization dahil na-block na nga yung potassium channel, hence a prolonged duration of action potential and refractory period. This reduces the heart excitability and suppresses the reentrant tachycardia. However, may mga adverse effect ito or this merong drug, take note, na merong mga drugs na kapag nasobrahan ng dosage ay imbis na maging anti-arrhythmic ay nagiging pro-arrhythmic. Especially the class 3 drugs. An example is amiodarone. Amiodarone has class 1 and class B properties, pero mas lamang ang class 3 properties ng amiodarone. This drug may also cause arrhythmia because of slow repolarization associated with longer QT interval and increased risk of torsodipointes. Ayun nga, yung imbis na mag-slow down na yung after depolarization ay dahil sa increased dosage of the drug ay mag-increase yung biglang tataas yung depolarization, which is the torsodipointes, or mag-precipitate pa siya ng arrhythmia. Ayun. Mas maging anti-arrhythmic siya, magiging pro-arrhythmic. So, next is the class 4 or calcium channel blockers. So, calcium channel blockers acts or are responsible for the SA and AV nodal cells. Blocking these channels result in a lower sinus rate and slower conduction to the AV node. So, pares po sila ng action ng beta blockers ng site through AV node. Blocking these channels result in a in a lower sinus rate and slower conduction through the AV node. However, because calcium is involved in cardiac myosin contraction, these agents also reduce contractility of the heart and should not be used in case of systolic heart failure. So since na-reduce na nga po yung calcium, kasi in the figure, the abnormal rhythm, ang biglang tumaas, hindi pa po nabablock yung calcium channel, biglang pagtaas ng rhythm because of influx of the calcium, while the violet line, common, nag-slow down na dahil na block na yung calcium channel, na-slow down na yung line, which leads to slower contractility dahil konti na lang yung calcium channel. And the last class of drug is the class 5. Class 5 has no distinct mechanism of action. So, hindi na po natin ma-elaborate yan since it has no distinct mechanism of action. So, that's all, and thank you for listening. See you in the next video.